Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I'm pleased to be joined by Adam Henley. Adam is a registered nurse, mental health therapist, and managing director and founder of Consortia Healthcare in Edmonton. In Adam's practice, he specializes in neuropsychiatric concerns like brain injury, dementia, stroke, and neurological disease. Please welcome to the podcast, Adam. Thank you for being here.
Hi, thanks, Amber.
So, very easy question to start off with. I would love to just give you an opportunity to explain a little more detail about your professional background and your areas of expertise.
Well, I'm not actually the most likely person to be talking about this today. I actually dropped out of a PhD when I was 23 years old. So I was a rising star in nursing that quickly floundered within probably a year or so of being a nurse. And at the time, I was working in inpatient oncology, which was something I kind of knew that I wanted to do fairly early in my career. And I was surrounded by distress, right? Primarily symptom distress. Um, and I was also quite interested in it, why patients would fail their therapy and what exactly was going on. So in many ways, the PhD dropout went back to nursing, but when I returned to nursing, I didn't go back to the hospital. Back in 2015, it was kind of like the Wild West. And I became ultimately a behavioral health consultant, but it was just beginning to be defined as a practice area here in Alberta. And so I was trained by Dr. Kent Corso's team in the United States around their biopsychosocial models of care, trying to integrate physical and mental health. And in many ways, I was in the right place at the right time. With my interest in oncology, I was surrounded by patients with uncontrolled diabetes in the community. And I started to notice this link between mental health and diabetes. In fact, I completed additional training on the linkages between mental health and diabetes through the Juvenile Diabetes Research Foundation, or JDRF. And to this day, there's very few psychologists who even consider those links. When your physical health isn't optimal, how does that promote mental health distress and vice versa? Now, back in 2015, I knew that there was something interesting, but I kind of thought psychologists were like this holy grail. We often think of them as this mystical. As a nurse, you often value anything they say about psychology. And so I thought, well, why not do a master's degree in psychology? And I did that, finished in 2021. And ever since then, I've kind of been at this intersection where I don't fit in between nursing and psychology. So teaching both nursing and psychology at universities, really talking about symptom distress as opposed to mental health distress, and not really seeing myself as an expert. So it's interesting, with that introduction, trying not to cringe too much. I honestly just have 5 jobs, and I'm in graduate school yet again doing a second master's degree to be a nurse practitioner. So I'm teaching at 3 universities, I have a policy position, and somehow I have this private practice that seems to, I kind of collect my patients like baseball cards. So they're just very interesting, fascinating people. And there's so many better people to talk about this than myself. But I think the problem is no one is talking about it. So when I start talking about it, some of these experts that actually exist encourage me to keep going, and they really push me forward in this topic.
I actually I think it's no small feat that you have 5 jobs and you have an incredible educational background and a professional background on this topic. So I think you're actually the perfect person for this. And you had reached out about this topic, which I think is very relevant to our audience. So I'd really like to focus our conversation on how stress and trauma can impact our physical health. And to start that off with, you teach a course that speaks on psychoneuroimmunology of trauma. Can you explain in simple terms what that is?
Yeah, it's funny, this health psychology course that I teach, it's really this topic sometimes gets cut out of that course because it's just too much. And then, the students start thinking they're going to fail their midterm and, presenting it in the first few weeks, it's a lot of info. So sometimes I include it, sometimes I don't. I guess depends if it's nice Adam or mean Adam teaching the course. But it's such an important topic, right? We take it for granted now that the body and mind are connected, yet very few people can actually explain how that happens. And so when I try to teach the body-mind connection, psychoneuroimmunology is just a natural fit with that, right? It's a perfect way to explain how basically your immune system responds to shifts due to stress or environmental things. And in fact, when I teach it, it sets me up to teach a bit more about how hostile environments in general change our biology, and they actually change us as an organism, not just humans, but other animals. And this all started in the 1950s. Some fairly famous endocrinologists at McGill University, like Hans Selye, and actually, McGill continues to be a neurology center for internationally. It's quite well known for their research. But it really started with Hans Selye looking at stress and adaptation. And it ultimately ended with psychologists digging into this a bit deeper. And so there's quite a few psychologists now that are both biologists and psychologists looking at the connections between stress. So there's a few things we know. Like we know that there's these adaptive shifts in immunity that occur. For example, like you're more likely to get a cold if you're exposed to stressful life events. I think we know that intuitively, but it's hard to explain how that happens for a lot of people. Really, from these studies of the common cold, we know that we actually shift our immunity away from the CD4, CD8 cells, which are really our specific immunity or viral immunity, and we push it more towards non-specific defenses. And maybe I'll come back to that in a bit, but certainly this adaptive shift has a psychological component or an evolutionary component for our survival. So really, the privilege of fighting a virus is the privilege of being a social animal. And, not being in a supportive social environment, the question becomes, why do you need to fight viruses from other people if you're yourself isolated? And then there's all these stress-linked disorders as this shift occurs, right? Like we see immunosuppressive issues. We also paradoxically see like these kind of overactivations of the immune system from the non-specific response. So a bit more autoimmune disease. You'll often see like people with Crohn's disease, MS, these pro-inflammatory phenotypes kind of play a role in the progression of those diseases. Often when I connect with someone who has MS, they'll say things like, I was good until I had a really stressful job. And then all of those traumas that I didn't manage, they kind of came out. And first it came out through their skin. They started to notice like more pimples and acne, a few more rashes, and then it came out in their brain. And they actually developed the first signs of MS. Now, what's really interesting is a lot of these diseases are linked to viral infection. So in the case of MS, we have this hypothesis around even like Epstein-Barr virus. And does that actually cause MS, this chronic infection with a virus? And then there's all sorts of other things, which I know other psychologists talk a lot about, the metabolic residue of child poverty or the residue of chronic stress, which we all see. And I would say a lot of us carry, myself included.
Yeah, and I definitely want to get more into that. I mean, as you said at the beginning of our conversation, not a lot of people are talking about this. I mean, I think Gabor Mate comes to mind as like the most prominent person out there that's kind of making these links publicly. So I do think it's important for us to break down some of the terminology and get comfortable. So just to take a little bit of a step back here, can you explain what a biological model is and what are biological models for stress?
It's interesting. I would say that although your physician is likely to cause or call it a biological model and look at bio causes, for myself, I would look at it more as a biopsychosocial model.
Hmm.
And I think that's a very rare perspective in today's world. We have the psychosocial people and the biomedical people, and they tend to look at the world two different ways. And very rarely do you have someone bridging that gap. And that's, I think, partly why these conversations aren't happening, right? Is because the psychologists are looking at things from a purely psychosocial model, and then your physician is looking at it from a narrowly biomedical model. And in fact, the chronic condition cannot be cured until you look at the biopsychosocial model. I actually recently completed this assignment for one of my graduate courses looking at stroke rehabilitation. And we're talking about dietary adherence and how poor it is, after a stroke, but it's actually strongly predicted by mental health distress. So your ability to prevent a second stroke, to actually heal from a fairly serious metabolic disease, is predicted almost entirely by your level of distress after the stroke. And it really calls into question, like, what are we doing? Like separating the psychologist into mental health and siloing them. There's kind of a good quote from Hippocrates, before you heal someone, ask them if they're willing to give up the things that made them sick. If you think about it, though, who really wants to heal trauma, right? Like the process sucks. Like often when I hear a patient wants to talk to me about trauma, I kind of like cringe a bit. Like, who am I to talk about trauma? It's not fun. I mean, people just want to move on. I honestly think they're going to feel worse before they feel better most of the time. And you can't really talk about trauma because your body keeps the score. So whenever you want to talk about trauma, you're going to feel pain, literally or figuratively. And you're going to feel that stress response in your body. And, it's really interesting. The McGill Pain Questionnaire is kind of based on this idea of this biopsychosocial approach. And it mentions that the sensory, affective, and cognitive components combine into kind of this matrix, which we call the neural matrix of pain. And that's exactly what happens in trauma, right? This trauma body overtakes you, and you literally get stuck in this matrix. So it's not entirely physical. I would argue it's not entirely mental either. And then you have this person in the intersection trying to navigate it, and people are just walking every which way.
Yeah, I do think there's a positive shift happening in the space where we're bridging the gap between physical and mental, but there's still so much more to be done there. Um, you had previously started to mention some of the inflammatory reactions in the body as a result of chronic stress. Could you just talk about that a little bit more?
Yeah. Well, so to go back to that example, like this sick animal in the wild, right? This person, leaving the pack, if you will. Well, why do we do that? Why do we leave the pack when we're sick? And the fact is, this stress reaction shifts our immunity, and it's quite dangerous to be around people when we are activated with stress. We know that it actually benefits us at times to live in isolation. And trauma naturally is built into this, what I would call a reflexive response, right? Trauma isolates us from the world. It actually, in many cases, shuts off the speech centers of our brain as well. So you'll see people with trauma, they have all sorts of activity in their brain, but the areas that control speech actually shut down and they're less able to even speak their trauma, which has implications for therapy. I guess if I come back to the inflammatory reaction, though, it's at the center of this. yet it's overlooked as a consequence.
Mm.
So we always think of inflammation as the output, when I would argue it's actually the origin of trauma.
Mm.
The inflammatory reaction in the body is what sustains the adrenaline response, right? When the adrenaline is pro-inflammatory and kind of going through us, it is exactly what's motivating for us. But that has impacts on the brain, right? And so to counteract those negative impacts, we also have a healing hormone that we call cortisol. And this stress hormone, everyone thinks of cortisol as if it's like adrenaline, but it's actually meant to clean up the mess that adrenaline causes in your body.
Mm.
So adrenaline, that's pro-inflammatory, that stimulates us, and cortisol helps us relax and heal. Now, what happens to someone with chronic stress or even acute stress is the adrenaline is completely unregulated. As we all know, in those moments of anxiety, our body can create as much adrenaline as we want. We can literally think adrenaline into existence. We cannot think cortisol into existence. Cortisol is tightly regulated in our body. And the more that we use cortisol, the more our body tries to regulate it and basically get rid of it. So we have an imbalance between the inflammatory process of stress and the anti-inflammatory treatments of it. And this discrepancy is why we actually shift or change in some way in response to these stress reactions. So as we lose out on our chronic cortisol levels and that system kind of collapses on us a bit, we don't become as social. We have to isolate. We become quite fatigued. We really struggle with maintaining our daily life. And just like the animal who's sick in the wild, you'll see people do that as well.
I really appreciate the way that you answer these questions, because I think for so many people who have been through trauma, we always are searching for the why, and you're doing such an amazing job already of putting on some light bulbs for even myself. So I'm sure the listeners are really enjoying this. You have mentioned a couple major diseases that have been linked to acute stress or trauma. I heard you mention Crohn's and MS. Are there any other major diseases that have been linked through research to trauma?
It's really interesting, Amber. So when I think of like even the way I present myself, right? And I know that like my body has been shaped by trauma, but what exactly does trauma do to us? And when I think about it, it does pretty much everything to us, right? Trauma has, from a child to adulthood, entirely shapes your biology. Everyone talks about how exercise is this miracle cure, but trauma is the miracle disease, right? Trauma, it seems to infect us. It seems to destabilize disease conditions. Like the patient with cancer, if you don't manage their distress, their chance of survival declines significantly, as if they didn't receive chemotherapy. So trauma, it's like wild stuff, right? Like it's amazing that we've siloed it into mental health, because have you ever noticed someone with chronic pain and trauma? Like they are so activated.
Right.
And they don't want to hear that it's all in their head because they feel the pain in their body. And like, what about someone with disability and trauma, right? Like the fact that their disability is preventing them from getting out of trauma. There's other things too that people don't realize, like obesity and trauma. A lot of people who can't lose weight are stuck in this chronic cycle of a pro-inflammatory state. Or asthma and trauma, right? Like people who just can't control their asthma, maybe it's provoked by stress or was initially in their life. And so we always talk about how trauma breaks the body, but I don't think people really talk about the adaptation shift that occurs. But if we go back to the 1950s, that's what Hans Selye talked about, right? This generalized adaptation syndrome, where basically we start off with an alarm, And at that point, stress is good. And then we resist stress and we try to adapt. And eventually, as an organism, we become quite exhausted. And it's really hard to keep up with that.
Um, I do want to talk about something you just mentioned, which is, you know, kind of what can we do about it and how do we adapt? So if someone is listening to this conversation right now and the light bulbs are going off like they are for me, and they're sort of sitting in this space of like, okay, so trauma caused what's happening in my body. Is there anything that can be done now to treat or reverse these types of reactions in the body if someone is living with PTSD, for example? Or can you just talk about that a little bit more? Can anything be reversed of the reaction in the body?
It's interesting. Like in some ways, I feel like I'm just like when I talk about stress, I have so much to share. In fact, talking about stress makes people feel stress. So it's
Yes.
interesting to see that even. So it's like you just talk quicker when you talk about stress compared to other things, right? And it's funny, everything goes on about how we think stress into existence. And that's the benefit of our cognitive behavioral models. But in trauma, I would say you feel before you think, right?
Mm,
Now, a lot of psychologists are now trauma informed, so they're aware of these differences and they're coming out with more complex, multifaceted interventions. Like I've even seen a few of them talk about this on this podcast,
mhm.
kind of acknowledging that any single intervention doesn't work on its own. So kind of
Right.
combining them. To think about trauma, though, you have to kind of look at the midbrain function. So we always think of our brain, and we don't realize it's built on this ancient architecture. So we have a lizard brain, like our brain stem, and on top of that, we have our mammal brain, our midbrain, and then our brain is built on top of this structure. So if we talk about midbrain function, what turns a koala bear into a tiger?
Mm,
The amygdala, for the most part, would turn our comforting, loving emotions into maybe more negative emotions. And people who have been affected by trauma have this midbrain that is ready to fire, ready to hunt, ready to run away. And it comes across in the smallest things. Like a lot of people with trauma don't trust their therapist
right.
because they process the smiles differently. So a neutral smile is actually threatening to them,
Mm,
right? So if you're even just neutral, a person with trauma will see that as negative, right? And they'll feel
right.
some rejection from that. So you have to, as a psychologist, you have to specialize in that. Um, and I know a few psychologists who are quite good at that, who can disarm and connect with people who are kind of in that defense mode. But if I come back to the lizard brain, that deep kind of primitive part of us living in stress, it begins to feel normal to us. And that's the part of our body that regulates our blood pressure, our pulse. So now when you try to tell someone to relax, you're pushing their body into a state that feels dysregulated.
Right.
Like peace can feel incredibly overwhelming to us because
Mm,
we're not used to that sense of complete and utter relaxation. Like if you notice like the feeling of love, you know, when you're completely enamored and it's just incredibly positive, you're overwhelmed by how off-putting it is to you
right.
as an organism. And when you're living in stress, simply taking a breath and pausing, it feels abnormal, right? It doesn't feel normal to us. And shutting off relaxation for some people is not something they do on a day-to-day basis. They have, or they're used to living in stress.
Right.
And that's why they live in a trauma body, right? Their body is entirely encompassed by stress.
Mm. So that's a good segue into my next question because, you know, you've said a lot about how stress can impact our bodies and all the very negative things that come with that. And in many ways, we can't prevent stressful things from happening, and we can't necessarily prevent traumas from happening. So, how can we prevent these physical reactions from taking over our body when stress does come into play?
Yeah, really interesting. Like therapy is great for a lot of people, right? And you have to really think about the context for therapy. But if you're living in that pain body, you know, how do you start noticing that you're living in pain?
Mm.
Um, One of the things that I find interesting is like people with PTSD, they have to get used to noticing anger without retaliation, right? Like not everything needs, you don't have to be the karma for everyone in your life, right? So
Right.
you don't have to react. Someone else can be the karma for that person. You don't have to, call them up and tell them exactly how you feel. But telling someone with PTSD that it's a tough sell, right? To tell them you don't have to be the karma today. Like I don't know, Amber, have you ever like been angry with someone and you've just been holding on to it and you're noticing your body and it just feels nice to let it out? Like
Yes. Yes, for sure. Yeah, I think that's, I mean, I've certainly heard many therapists even speak to just getting a physical release of an emotion can be sometimes really powerful in itself. But yeah, I think a lot of people suppress emotions when they're too big, right?
yeah, and so when we have this like anger that no one, like the one thing a therapist doesn't want to talk about is anger, right? So like you're going to go to the therapist, and there's kind of a joke. Dr. David Burns, he's a pretty big figure in CBT. He says, the one thing that a therapist will minimize and avoid is anger because you don't know where it's going to go, right?
Mm.
It's a dangerous emotion. And yet, anger is one of the most healing emotions. If you can
Right.
learn to sit and you notice it, what you're really noticing is the most pure form of stress, right? That reaction in you. And you see how you can transform it in that moment. So, anger is incredibly high potential emotion, I say. If people have a lot of anger, you can really work with trauma, and you can, if you're willing to work with anger, you can go quite far with people. But like today, we don't talk about anger, right? We don't, on a personal level, if I feel angry about something that happened, there's really not a space for you to feel angry without looking silly or, burning bridges. Like in today's society, we box up anger. So people are, I would say, walking around with a lot of it, day to day. And if that's the case, you probably want to block off time to exercise before therapy, right? You want to eat well for the few days before your session. You probably want to sleep a bit extra after therapy because you aren't just processing your mind, you're processing your body. So this whole idea of therapy being fun or relaxing, I mean, maybe it's sold that way, but most people would admit that it's actually a bit of an intense process to tackle, trauma. And when your body's processing, like there's this antecedent of disease that exists in that moment of therapy too. So, like this idea that if I didn't experience this negative event, then maybe my body would be better, right? Maybe my disease wouldn't exist. And honoring your body makes therapy so much more impactful because you notice how much more limited you are and um, how imperfect we are as people. So it makes it easier for us to acknowledge our weaknesses or those things that maybe we're not perfect with our behaviors.
Yeah, you had mentioned that there, certainly we only exclusively work with therapists who are trauma informed, and there is more of a conversation happening between body brain connection in that space. Have you come across any therapeutic modalities that are particularly beneficial for treating the physical reaction to trauma?
Yeah, like you probably talked about EMDR. I haven't seen that one, but EMDR is a great therapy for trauma, very physical too. It's built into the
Mm.
neurobiology of the brain. I've seen a lot more psychologists talk about somatic therapies. so purposely connecting to the body, and that's great. Partly because they get trained in the body as part of learning those therapies, so that's really good for those psychologists. Um, I'm kind of a go to the gates of hell and start cleaning kind of guy, right? So like
Right.
I don't pretend to be the Zen therapist. As a nurse, so, people kind of expect me to be a bit less accomplished in my therapy. And one of the types of styles that I really like is something called acceptance and commitment therapy. That idea of embracing imperfection and kind of delinking from it, which in that process is called cognitive diffusion. And I think I'll share a bit of my own experience. I myself have trauma that I live with and have in some ways treated. Um, my mother had postpartum psychosis and was hospitalized shortly after my birth. So when I was 2 months old, I was taken out of my home with my biological brother, and I was in foster care till I was about 4 or 5 years old. Can't quite remember when it actually ended. And I had four great homes and one horrible one here in Canada. And there was never any accountability over the horrible experience that I had when I was like 3 or 4 years old. But I kept wetting the bed. My body wasn't on my side. I was puking after every meal. I was incredibly stressed. And this carries with me, right? I have esophageal changes. I have changes, things like that. And so over time, thankfully, it wasn't my adult teeth. My baby teeth had rotten, and I looked quite disheveled as a child. My clothes were too small for me in that home. And here's the thing. My foster parents, instead of seeing me as someone in trauma, they saw me as a problem. They had kids of their own. The neglect started when they told me at 4 years old, like, sit outside on the patio because we don't want you puking at the kitchen again. We're tired of cleaning up after you. And that depersonalization was a process by which I became myself, kind of the paycheck, I guess, that they get. And the hardest thing was like my biological brother ate inside with the family, but I was on the patio while I actually had these medical issues from stress. Now it's funny, I was going to sue Thunder Bay Children's Aid Society when I was a teenager. So I had one of those fee for service lawyers. They actually requested a bunch of documentation, and the social workers who cared for me didn't take care of me as a person. They overlooked, there's no documentation of my trauma. They documented me wetting the bed, puking, but they didn't document my trauma at all. And you know, this has always bugged me as a nurse. Nursing, we don't really like people with disabilities or mental illness. They don't really make it through nursing school for the most part. Here I am teaching nurses, and I have to cover up my past because nurses, for the most part, are pretty privileged individuals. But trauma from a very young age has broken my body, right? Like I sound like I've smoked as a child. I've never smoked in my life. I I've used cannabis, but other than that, I'm not much different from most of the privileged nursing students. But it doesn't take a genius to see how different I am, especially as a professional. And that's kind of the challenge, right? As an adult, is as a nurse, you see trauma when I teach. I see trauma in the homeless individuals when I work in emergency settings, but they also see it in me when I go to job interviews, when I can have qualifications. And so, really interesting point. I was actually recently interviewed, like this year, to work as an educator at Alberta Hospital. So you'd think they'd be quite trauma informed. And they started the interview asking like if I've ever been disciplined as a nurse or like incarcerated. And that was the very first question of that interview. And it completely surprised me. Like I would never assume, like I always assume the best in people. I would never assume that's like their first concern.
Right.
And I knew that they asked it like to shut it down, right? Like to
Right.
like if I did say yes to anything like that, it's over, but what did that tell me? Well, it told me that's an incredible question of privilege for those people to be asking. Not only did I have a master's degree and they didn't, but these managers, they clearly don't understand the process of the patients they serve. These people, they're talking about Recovery Alberta. These people, they'll never recover if you ask a question like that.
Right.
You've basically excluded maybe the Indigenous nurse with some sort of struggle, or the person who has rebuilt their life. Like, I could have easily been any one of those people. And people like nurses, we always think we're better than our patient, or like we're the professional and they're the patient. But the one thing that trauma has taught me is I can't answer that question normally because I feel exactly the same as that
Mhm.
person. I'm just lucky I didn't have so many disadvantages that I got pushed into that different path in life. But when I see my body and I see how trauma has aged me, or when I see how my technical skills don't really make up for the fact that I have trauma reactions, then I notice how healthcare isn't built for trauma, right? Like Alberta Hospital, it for some people with trauma, it's possible it might break them, right? If they're not trauma informed. And sometimes I think I'm lucky I dodged a bullet there. I don't want to work for Arkham Asylum, so
Right.
maybe figure it out, do something else with my life. But I'm lucky to be able to teach and talk about these things. And when things like that happen, people need therapy. I probably should talk to someone about that experience, because my trauma is actually my strength. So to reformat it as a weakness, it's not helpful to my patients, and it's not helpful to me as a person. You know, Sometimes I make people jealous when I work as a nurse. Like I worked on a geriatric psychiatry team, and my insights and predictions about people with dementia would often shock families, or really surprise the physicians. And I have this psychiatrist who I worked with, and they were flipping through my report quite quickly. So I was kind of getting offended, trauma response. I was like, why are they flipping to the end of my report? So I eventually asked, and I said, hey, um, why are you flipping to page 8? Like I put a lot of good details in like all my biological stuff, my medication review. It's all in those first pages. Skipping to page like 8 and 9 at the back of my report. And what's really interesting is they said, Adam, your psychiatric impression is the best read I have all week. And it's like I just love reading the story that you share of the patients and the care that you put into this impression. And he's like, it completely changes how I read your report. And they even said, I read all the other stuff before the visit, but I actually come back to this to read it a second time. Like,
Mhm.
I really appreciate the way you see the patient. And that's kind of like what makes trauma is what makes me do that, right?
Mhm.
I'm like that horse that feels your emotions, or I don't quite react perfectly just like the horse, but I know that I can sense your heart rate changing. I I know that you're in pain. I notice you, and I have that presence. And when I think of it, I see a lot of that comes from trauma.
Yeah, you said, I mean, first of all, thank you so much for sharing some of your personal story. I think it's really powerful, and certainly in the work that we do, people sharing their story is always very impactful because a lot of people will hear their story and something that you said. So I do appreciate you sharing that. There was so many things that you just mentioned that I think are important lessons in general. Being more empathetic in support spaces, still continued need for more trauma informed lenses in all types of communities. But, it's great that you're part of breaking the cycle and you get to now bring trauma into the conversation. I think that is a big struggle for a lot of people. But I also think people who have been through trauma really like working with someone who gets it. And I think most therapists come from that space because that's probably why they got into it in the first place, but not many are willing to share that. So I do appreciate you speaking on that. I think it's an important that's an important piece for people to hear. So I really appreciate you sharing your perspective on that today. It's very helpful, I'm sure. um,
Yeah, thank
I
you.
wondered if you could, you've been such an amazing wealth of knowledge here. There's been so many great things. Do you have any recommended resources for anyone who's listening who wants to specifically learn about any research or anything more around the topic of the body response to trauma?
So you know what's really funny, Amber? When I see people with trauma, like a friend or a colleague, and they share their story, I just like dump resources on them. Like I'm like, oh, you got to take care of this. Then thank you so much for sharing. And I don't always share my story, but a few people know about it. And there's places I share it more readily. There's places where, like all of us, we keep it to ourselves. If you're finding you can't share your story, I'd say start out with those thinkers, right? You mentioned Gabor Mate earlier. Uh, Really great. This person who has advanced the conversation around trauma and the body, ironically, a family physician in the past. Someone that really helped me was Eckert Tolle, this idea of being in the now, being present. Um, Stephen Hayes is the founder of acceptance and commitment therapy. He's a psychologist. And what I really like about his work is he created this idea of relational frame theory, which is really evidence based. And it's the basis for kind of rethinking things in a different way. And actually, that's built into it's called the Alberta Family Wellness Initiative. They have something called Brain Story Certification. And if you really want to talk trauma, you don't have to be a nurse or psychologist to do this. You could actually complete this rather mundane. It's quite long, but it's, a week of your life that if you have trauma, you'd likely enjoy doing that to see just how much it affects you. So yeah, so many resources. I'll try not to dump too many of them, but brain story certification and then some of those thinkers are great as well.
Those are great. It always, just reiterates how impactful some of these people are when they come up every podcast. So I think it's great for people to get those reminders. I always ask everyone this question, just in general, on the topic of trauma, outside of the trauma and the body. Are there any other resources that you think people should have in their toolkit?
Yeah, so many, right? Like it's really trauma is built into our life. So how do we actually get that? And, how do we move forward? In my mind, it all starts with trauma informed care. So like making sure your family doctor is trauma informed if you're struggling maybe with a psychiatric illness or medications. Um, just kind of building that into your life. Like if you're not trauma informed, how do you become trauma informed? There's all sorts of courses that are out there. Most of them are free. And yeah, I'd say that's where I'd begin.
That's perfect. I think that's really well said. Um, Again, this has been very insightful conversation. I'm very much a science person, so I really appreciate conversations like this. So I do thank you for your expertise today. Is there anything else you would like to share with our listeners before we close?
Well, just like if you can't afford therapy and you want to reach out, I think you guys have a great support group. So definitely like think about places who are trauma informed, who really want to get connected to you and help you through this. And I see the Breaking Free Foundation as one of those organizations.
Thank you so much for that. Thank you again, Adam, for being on the show today. If anyone is looking for more information about Adam and his practice, you can see our show notes.
Yeah, thanks so much.
The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.